OBGYNs. Doctors would see new mothers sooner and more frequently, and insurance companies would have to cover all of those visits.
The goal is to have better health for new moms and their children. We want to talk about these new recommendations with our medical expert, Dr. Mandira Mehra with SSM Health. Good morning. Good
morning. Nice to see you.
Good morning.
So we were kind of reminiscing about our own experiences with this. What's going on here for new moms, and what really is the goal behind changing this?
I think the American Academy of OBGYN is recognizing that we can't just put all of the focus on the new babies. We all love new babies. New babies are this great gift and blessing.
Smell great.
They smell great. Everybody wants to hold them, but we can't discard the mom's health, mental and physical. So we're now recognizing that those first few weeks, even few days, can be very trying for a new mom, physically, mentally, physiologically, philosophically, and we can't really ignore that and just have that one follow-up that traditionally is about 4 to 6 weeks after you've had the baby or postpartum. So in a 15-20-minute visit, just once, can we really touch upon all those issues that might be plaguing a new mom? You know, you're lactating, you might be hemorrhaging, you might have had a complicated pregnancy, you may also have chronic medical conditions, hypertension, diabetes, cardiac issues. That, of course, makes the maternal health very important and risk factors very important.
I'd imagine covering this, though. I mean, it's always a cost factor, right? Isn't that what's going on here?
Exactly. And so the limiting factor is always, what is the insurance company going to cover versus how much can the new mom really do? Like I was saying, Adam, I was very surprised that 20–30% of moms go back to work even within that first 10 days to 2 weeks. So how then is that new mom going to get time off 4 to 6 weeks later, childcare, that sort of thing, to then go to the OB/GYN and follow up with these issues? So this is really promising that they're making these recommendations. We'll get insurance to cover it, and then we'll have more frequent care as well as sooner follow-up, hopefully.
Yeah, a lot of factors to consider. The other topic we wanted to talk with you about is kind of at the other end of life. And with our former president, George H.W. Bush, being hospitalized, he's doing better this morning, which is good news to hear. But this was just a day after his wife's funeral. He's been with his wife, or he had been with his wife, for 73 years. And we hear about this broken heart syndrome. This is a real thing.
It is a real thing, and so we're not in any way trying to say, I'm not trying to say I was involved in his care or that I know that this is what happened. But like you said, Danica, the timing is very notable here, that within 24 hours after his wife's funeral, he was admitted to the hospital. And so broken heart syndrome is a real phenomenon, first defined by the Japanese physicians, where they noticed that the heart actually represented a weakening or an apical ballooning in response to a very, very tragic event or very stressful event where the body's stress hormone, we talk about that cortisol, it spikes. I mean, you think about a flash flood of cortisol. The body then will respond to that differently. But one of the things that can happen is this broken heart syndrome. So you present almost like it is a heart attack, but in reality it's not the vessels getting clogged, it's a response to this cortisol level. So in his case, maybe that was part of it. Of course, we know the immune system also doesn't respond well to this spike in cortisol. Your immune system is unable to really fight those flus, infections, and colds, those sorts of things. So I know that his people, at least, had released a statement that he had perhaps had a flu or infection, that kind of thing. So again, maybe he was just unable to really fight off that infection the way that he normally would have been able to had he not had that surge of cortisol.
It's absolutely fascinating. Mehra, thank you so much.
Great to see you.
This morning.
Yeah.
Your time.